Hey, good optometry morning. So your eye surgeon has or probably will give you a very long list of some side effects that might happen in your cataract surgery. But there's a couple of them that are probably not going to be on that list. Hey, I'm Dr. Michael Nelson, your YouTube eye doctor, and today we're going to talk about some of those secret side effects that you might experience. But more importantly, we're going to talk about how you can actually cope with these side effects. But before we get into that, first of all, we need to understand what's the difference between a side effect and a complication. So a side effect is something that likely is going to happen, and we're actually not that surprised when it does happen, where it actually happens more often than not, and it's kind of a common thing that we're willing to accept because it's not a serious problem. Now, a complication is something that we don't expect to happen, but it may happen, and it may happen even if everything has gone perfectly correct and no one has done anything wrong in a surgery. So let's think about it this way. If you swim in the ocean, a side effect of swimming in the ocean could be getting salt water in your eyes and your eyes stinging and burning. That's a side effect. So that's something that you almost expect to happen, and you're not that surprised when it does happen. Now, a complication of swimming might be getting stung by a jellyfish. Now, you realize that could be a real possibility, not something that I expect. It's not likely to happen, but some people it does happen. So let me tell you about 4 patients that I had that had different side effects from cataract surgery and how we dealt with them. So Tina came into me for the 1-week post-op check after her cataract surgery. Now, she said to me, hey, my vision is much, much better than it was going into the surgery because my cataracts were really, really bad. However, my vision is still kind of foggy. It's not really clear. I'm not really happy, and I'm pretty sensitive to light. I was hoping I would have better vision than I have right now. So at the 1-week post-op cataract surgery visit, one of the main things we're looking at is what your visual acuity is. That is how small of letter you can see. And we're hoping you can get to see the 20/20 or close to the 20/20 line at the 1-week point. Now, if you don't, the first thing we're checking is if you're farsighted, nearsighted, or have some residual astigmatism remaining after the cataract surgery. So I checked that with Tina, and she had no prescription. Her prescription was 0, so that was right on, but her vision still wasn't quite 20/20, and she found it a little bit foggy. So I took a closer look with one of the microscopes we use, and I looked at the cornea, which is the clear tissue in front, and that looked perfectly clear. I looked at the lens implant, that looked centered and nice and clear, and there was no cloudiness in that. And I took a look at the retina, and we did some scans of the retina, and the retina looked great as well. But what I did see was some haze and cloudiness in the anterior chamber of your eye. Now, the anterior chamber of the eye is the fluid-filled area between the cornea, which is the clear tissue on the front, and the iris, and then behind the iris is the lens implant. It's that fluid-filled chamber in the front of the eye. And what I saw is I saw some cloudiness, a little bit of haze, and with some really high magnification, I saw little white pinpoint dots, which actually are white blood cells in the anterior chamber. And so what this is called is post-surgical iritis or inflammation. And it is a common and expected finding after any surgery. You're going to have some inflammation of that tissue. And so at the 1-week point, it's not unusual to see some haziness in the anterior chamber, but Tina had a lot more than average. And there was enough in Tina's eyes that it was causing some cloudiness and it was causing some light scatter, giving her some more sensitivity to light. And now the likely reason why this was happening in Tina is because her cataract was really, really advanced. And so what that means is that the surgeon had to use a little bit more energy to break up that cataract, and it probably took a little bit more time, and all of that caused more inflammation in her eye, resulting in more inflammation than typical at the 1-week point. So I told Tina, hey, we see this inflammation, but we have something that can deal with this. One of the eye drops that you may use before the surgery and certainly after the surgery is a steroid eye drop. And so what we need to do is increase the frequency and the duration of Tina using the steroid eye drop. And in a week or 2, that inflammation is going to quiet down and she's going to start to see a little bit better. So the question is when you need to call the doctor about this. From this point forward, if she started to experience any increased pain or reduced vision, she needs to call us because it might be a sign of a bigger problem. All right, so patient number 2 was Gary. Now, Gary also came to see us at the 1-week post-op visit. And Gary was pretty concerned because his eye was bleeding, so he was wondering if maybe the wound had broken loose or maybe a stitch has come loose, and he was starting to bleed more than he should. So I took a look at Gary's eyes, and his vision was really great, but his eye was a little bit tender, but it wasn't painful. And so when I looked with the microscope, what I saw was that there was a large red hemorrhage on the white part of his eye. And the white part of the eye is called the conjunctiva. And so basically this is something that we call a subconjunctival hemorrhage, which is a fancy name for a bruise. So subconjunctival hemorrhages can look pretty scary, but oftentimes they're relatively harmless. Now the important thing to remember is that it's not the incision that's opened up again to cause this hemorrhage, because the incision made for most cataract surgeries is in the cornea, which is the clear tissue on the front of the eye that actually has no blood vessels at all. In fact, in most cataract surgeries, there are not any blood vessels that are cut ever. And the other thing to know is that this isn't a stitch that's come loose, because in most cataract surgeries, there are no stitches that are put in place. So these subconjunctival hemorrhages can happen in any surgery, and it doesn't happen because something's been cut, but it's usually because of some type of pressure. Maybe there's an instrument or some pressure put on the eye in some way that causes a hemorrhage. The other thing that's good to know is that the conjunctiva is very loose, so blood can pool down, and it sometimes can look really scary because it all pools at the lower portion of the eye, and it sometimes even looks like it's getting a little bit bigger. But it's just the blood spreading around underneath the tissue. The good news is that these subconjunctival hemorrhages are going to resolve on their own in a few weeks. There's not any treatment, there's no eye drops, the anti-redness drops aren't going to help clear this up. So this can also be common if someone's on a blood thinner, because your blood won't clot quite as easily. But in most cases, there's not any reason to go off your blood thinners. Unfortunately, there's not any treatment that we can do to clear this up faster. We just gotta wait. And I've done a whole video on subconjunctival hemorrhage, and if you want to watch that, it's right up here. All right, so the third patient that came in is Margaret, and Margaret also came in at the 1 week post-op visit. And so when she came in, I asked her, hey, how did the cataract surgery go? And she said, horrible, I am not happy at all. And so I thought, oh no. So I started to take a look. So we checked her vision. She was reading the 20/20 line. She didn't have any residual nearsighted, farsightedness, or astigmatism. Her eye was comfortable. She didn't have any pain, no discomfort, no halos, no glare, no light sensitivity, no fogging in her vision, and her eye looked really great. There wasn't any redness, there wasn't any hemorrhages, there wasn't any inflammation on the front or the back of the eye. So I said to Margaret, this outcome actually looks really great. Why are you so unhappy? And she said, look at my eyelid. Look how droopy it is. It wasn't like this before the surgery. And so she pulled out some photos before the surgery, and then we looked at her eye after, and yeah, sure enough, her lid was drooping down. And so the medical term for when our lid starts to droop is called Tosis. And so I explained to Margaret that actually a ptosis is a common side effect that can happen after cataract surgery. And I said there's two different types of ptosis that can happen after cataract surgery. One is a transient ptosis and one is a persistent ptosis. And so the transient type is usually because there's some amount of inflammation in the upper lid, basically swelling in the upper lid. So that upper lid is a little bit fuller and a little bit heavier, and so gravity is pulling that down a little bit. And so that swelling will often go down in 1 to 2 weeks, and when it does, that lid will return to its normal position. Now the second type of ptosis after cataract surgery is persistent ptosis. And persistent ptosis is not due to the swelling of the upper lid. What it's thought to be due to is the instrument that holds your eyelid open during the surgery. So this instrument is called a speculum. So it's a metal spring-like device that holds the eyelid open so they can work on the eye without you blinking all the time. And now in some individuals, the pressure holding the eyelids open can weaken the muscles a little bit. And in particular, the upper lid muscle called the levator muscle. And if that muscle weakens a little bit, maybe it's not quite as strong, and so it droops down a little bit after the surgery. We call it persistent ptosis, but that doesn't mean it's there for good. Very often in these cases, that ptosis will resolve in about 6 months. The muscle will get a little bit stronger and develop its tension again, and that ptosis will go away. And so I said to Margaret, sometimes this lasts longer than 6 months, and if it does, she can come in to see me and we can get an appointment with a lid surgeon to try to lift that lid up again. Now the fourth patient that I saw was Eva, and Eva has the most common side effect after cataract surgery. And unfortunately, we don't have time to go into that, so if you want to learn about that, you need to watch this video right here. And with that, have a great optometry day.